Hi everyone, thanks for joining. I'm Amy Clair from the University of Essex, and I'm going to be talking a bit about my research on housing and health in the context of the COVID-19 pandemic, obviously focusing on private renters. So we've seen during the pandemic a bit of a shift in the way we've talked about housing. We've moved away a bit from housing to focusing on home. So this is an example from the NHS about how you're not stuck at home during the lockdown, you're safe at home. But this obviously will vary massively depending on people's housing experiences and situations. So obviously to be safe at home, firstly you need to have a home. And we know that the ending of a private rented sector tenancy is one of the leading causes of homelessness. And there's significant concern that there'll be a massive increase in evictions and homelessness once the eviction protections end. These were due to end just next week, but now have been extended to the 23rd of August. We also know that, for example, that some people are safer at home than others. How will sharers self-isolate when they're sharing kitchen and bathroom facilities? It's going to be much harder for them to avoid catching or spreading the virus to or from their housemates in those situations. Also, some people are being expected to lock down and self-isolate in homes that have unsafe cladding, for example. So there's massive variation in terms of how safe you are at home. When we talk about housing and health, we tend to focus on two main areas. So the physical conditions of home and the psychosocial or psychological conditions of home. So the conditions you live in, whether you experience damp, cold temperatures, for example, and whether your home feels secure and you feel in control of your own home. And the pandemic has affected both of these aspects of home. So the lockdown has affected our experiences of the physical qualities and conditions of home. We've been a lot more exposed to our homes during lockdown, and on a basic level, lockdown is going to be easier if you live in a well-maintained, spacious home with a garden, in a safe area with low levels of noise and air pollution and good access to facilities. Having more space will make adapting to the new role of the home easier. So if your home is now also your office where you work, or your gym where you exercise, or your children's school, this is going to be easier if you have more space. It also means you'll have more room to store supplies of essentials if you're expected to shelter in place for a long time, or when our ability to go shopping has been limited. So when we can go shopping once a week, for example. We've talked about the psychosocial conditions a bit already. So we've seen that this is affecting affordability and security, as well as people's ability to feel in control of their home. And these relate to the financial impacts of the crisis. But it's really essential to remember that the psychological and physical qualities of housing are interrelated. And it's because of this interrelationship that we mustn't focus on singular aspects of housing. When we do, we get flawed policy responses. So, for example, permitted developments, they're focused on trying to provide affordable housing, but that means a significant sacrifice in terms of quality, especially space. So in response to this interrelationship and the importance of considering housing as a whole, we've developed a housing precariousness measure, which includes aspects of quality, affordability, security, and access to services. This chart shows the levels of precariousness among owners and renters in the UK prior to the COVID-19 pandemic. And you can see that renters, indicated by the black line, do worse than owners, who are blue, on all four indicators of precariousness. They do much worse in terms of exposure to poor quality homes. We know that 25% of privately rented homes in England fail to meet the decent home standard, compared to just 13% of socially rented homes. Nearly 700 private rented homes have a Category 1 hazard, so that's a hazard that is deemed a serious and immediate risk to health. We can see that private renting is worse in terms of affordability than owning. Private renting is the least affordable tenure out of any, both in terms of the amount spent per week and the proportion of income spent on housing costs. Security, as we know, is low, and there are concerns about increased risk of eviction following the crisis. But there are small gaps between owners and renters in terms of access to essential facilities, although this will have probably been worse for many people during the crisis due to reduced public transport, for example. We know that private renters were already having a hard time This chart shows an exploration of the effect of the UK housing benefit changes in 2011 on the self-reported levels of depressive symptoms among private renters. So when in 2011 the local housing allowance was reduced from the median rental cost in an area to the 30th percentile, we found that this led to a nearly 2% increase in people reporting new depressive symptoms. These findings are consistent with work by the IFS, which found that the cuts didn't lead to falls in housing prices or rental prices as hoped. Instead, tenants were forced to spend less on their housing or find other ways of meeting the cost. So this means that while this reduction may have reduced housing benefit expenditure, it likely increased expenditure in other areas, particularly spending on health, because of the consequences for renters. I've also started some work looking at the impact of this change on the physical quality of homes people are able to access following the change. Reduced affordability means people are squeezing themselves into smaller homes, and we know that private rented sector homes are already smaller than those in other tenures. So private rental homes are on average 28% smaller than owned properties, according to Shelter. And this is preliminary work looking at the impact of this reduction in local housing allowance on overcrowding according to the bedroom standard. And you can see that the red line represents private renters who do not receive housing benefit, and the black line represents renters who do receive housing benefit. You can see after this change in policy, there was a big jump in the proportion of private renters receiving housing benefit and using housing benefit to meet their housing costs, living in overcrowded conditions. And this is going to have a significant impact on their experience of home and health even before the lockdown, but it means these people are experiencing lockdown in overcrowded homes, again with implications for trying to self-isolate and not spread the virus, as well as just the practical day-to-day living in your home. As well as looking at evidence related specifically to policy changes such as the reduction in the local housing allowance and looking at self-reported health, I've also done some work looking at the relationship between housing and people's physical health. So in a recent paper, we looked at C-reactive protein, which is a biomarker found in the blood that's related to levels of inflammation and stress, infection. So higher levels of this biomarker indicate worse health. And then we control for all sorts of factors, including people's age, gender, income, health behaviours, and so forth. We find that people in private rented homes have higher levels or worse levels of C-reactive protein in their blood. So this is likely reflecting the poorer quality, the lower levels of access to green space in private rented homes, something that's going to be exacerbated by the current situation. Interestingly, we also found that people living in detached homes had lower levels of C-reactive protein, so they had lower levels of this marker of inflammation. So again, possibly linking back to this idea of having access to green space, control and autonomy over your home, having privacy and having space, key to people's lockdown experience. It's important to remember that much of the negative effects of private renting will be due to the conscious decisions to prioritise and promote owner occupation above other tenures. So the subsidies through Help to Buy and expansions to Right to Buy in England support people moving into home ownership, while financial support for alternative tenures and particularly social rent have been significantly reduced. And this is again reflected in the housing policy response to the pandemic. So initially, while owners were given access to mortgage holidays, the notice period for evictions was extended. Evictions weren't paused, and then when they were paused, it was only for 3 months. There's been nothing done to provide renters with a way of reducing or pausing their rent. Again, they must rely on the goodwill of their landlords. Although there has been variation in the UK, or across the UK, as Scotland has acted at a greater extent to protect renters. It's also important to remember that inequalities in housing and health are likely to be exacerbated by the COVID-19 pandemic. So, for example, Black and minority ethnic people will be facing the double whammy of being more likely to get COVID-19 while having more difficulties in the housing market due to racism through steering into certain housing options and areas and refusal to rent. Disabled people also face significant challenges in finding suitable accommodation in the housing market, exacerbating their problems during lockdown, potentially. And people in receipt of social security have increasingly found it difficult to find landlords that will rent to them, significantly limiting their options and ability to find suitable accommodation. I think one of the important things that this highlights is that the pandemic is not creating new problems in the housing market, but exacerbating existing issues that were easier to ignore before the situation got so much worse. So the increased sharing, the increase in affordability, the insecurity, the poor quality housing, the issues to do with size, in combination with the change in the use of the private rented sector. It's desperately important that we change the rules around the private rented sector to reflect its new role. For example, households with children in the UK are increasingly living in private rented homes. In 1996-97, only 8% of households with dependent children lived in the private rented sector, and this is now over 25%. So over a quarter of households with children live in the private rented sector, which still has rules designed around the idea that the private rented sector is a transitory tenure for students, for people early in their careers, things like this. So there's significant implications for children's lives on top of the other disruption caused to their lives due to the pandemic. As well as expanding in size, the private rented sector is also housing people for longer periods of time. Half of private rented sector tenants in 2006 had been living in the private rented sector for over 5 years. So again, this is no longer a stepping stone tenure. We need the policies to reflect this. So moving on to conclusions and thoughts for the future. Although we've seen more talk about this idea of home and being safe at home, the idea of housing as a financial asset remains dominant. The fact that we saw the reopening of the housing market for prospective new tenants and for landlords to find new tenants before protecting renters from eviction sends a significant signal about priorities in terms of housing policy. However, in some positive news, we may see some positive impacts of private renters in terms of the effect of the crisis on things like Airbnb. We might see more homes returning to the private rented sector rather than for short-term let. And it's going to be vital that we include information on housing in COVID-19 surveys. So this is an opportunity to rethink the direction of our social policies over the longer term. This pandemic has demonstrated the problematic gaps in the social safety net and how they can quickly become catastrophic when the system comes under pressure. So it's going to be essential that we have as much information as possible so that we can improve our policies in the future. The pandemic has highlighted starkly the flaws in our current housing market, especially in the private rented sector. And the temporary fixes introduced at this time are not enough. We need long-term solutions that will include ending the focus on owner occupation as answer to all people's housing problems. The social rented sector has a key role to play and should be supported. Improving financial support for renters through the local housing allowance, raising it above the 30th percentile to at least the median to make significant chunks of the market affordable to people who need housing benefits to afford their homes. And making sure we take a whole home approach to housing policy, avoiding focusing on single issues and losing sight of the big picture. Thank you.